This episode is brought to you by Autotrader.ca. Shopping for a car can sometimes leave you feeling a bit on edge. Because how do you really know if you're getting a great price or not? Easy. You use the Autotrader app. Autotrader compares and rates millions of cars using live market pricing. They let you know when the price of a car is great, good, fair, or above average. So you can feel confident you're getting a great car at a great price. Get the Autotrader app today.
Coming up on the Scott Thompson Show podcast, the latest on the stay-at-home order, clarification on vaccination in Hamilton, and we play an interview that aired on CHML back in 1957 with Paul Hanover and a survivor of Vimy Ridge. It is riveting radio, and it's coming up.
Today on the Scott Thompson Show on 900 CHML.
I'm Curtis Thompson, Scott's son. I know everyone is cranky about another stay-at-home order. However, for most of us, home isn't all that bad. Excluding sisters, of course. It's the Scott Thompson Home Show. Here's Scott Thompson!
You know, you're thinking with the whole COVID thing and the cabin fever and everybody staying at home, you know, sometimes the family gets closer. It's a good thing. I don't know about sibling rivalry, though. Good afternoon. It is 12:11. It is 900 CHML. I'm Scott Thompson. Is it Friday? Hang on a sec. Is it? It is Friday. Yes, it is Friday. All right. A Friday heading into a stay-at-home weekend. So I hope you got lots of popcorn and toilet paper. Feel free to jump into the conversation. We would love to hear from you. Lots of ways to do that. As we get into the latter part of the show, going to talk, of course, about the passing of Prince Philip, and also a very cool guest whose great uncle, Clem Burtis, was interviewed by Paul Hanover on 900 CHML. I believe this was back in 1957, the 40th anniversary of the Battle of Vimy Ridge, and had other connections to the history as well. So interesting hour in the final hour as we talk about things historic as opposed to the current state of affairs with the COVID-19 global pandemic. All right, we're going to play you a report here about where we are, where we're going, talking about lockdown and why we're heading back here for a third time. Ontario today, 4,227 new cases, 18 have passed away.
Dr. Barbara Yaffe says she understands why people are upset with this latest measure.
It's a tough time. Everybody's sick and tired of the whole thing. And we want to just, get out, have a nice summer.
But she says it will help get a hold on the rapidly increasing transmission of the disease while at the same time allowing for more vaccine to get into arms before reopening.
We're hoping these measures won't, that they won't last more than a month.
Dr. Yaffe says the ICU numbers have been getting higher and putting a strain on the already stressed healthcare system. Dr. Dirk Heyer added that 40% of adults will be able to get vaccinated by the end of the stay-at-home order, but it's not clear yet if that's enough to prevent another lockdown from happening down the road. Dave Woodard, Global News.
All right, let's bring in Dr. Isaac Bogosh, Staff Physician, General Internal Medicine and Infectious Disease Associate Professor, Department of Medicine, University of Toronto, and is with us now. Doctor, thank you for the time. I know you're busy. Hope you're doing well.
Yeah, not bad. I love the intro with your son at the beginning. That's fantastic.
Yeah, we've been doing that for 55 weeks now. He's here. You might as well have him doing something. Although they are at school, but certainly during the shutdowns when the schools were out, he was actually doing them live. So now it's a hassle to get him to record them all the night before. You know what I mean?
I like the Sisters of Concern instead of Variants of Concern. I thought that was pretty funny.
Hey, you might have a new term right there. It's great we can make light of this, and I guess perhaps that's what you have to do considering where we are. We certainly know where we are. Cases in Ontario up over 4,200. Is this the fallout from Easter, Doctor, or is it too early for that?
No, this could be the start of it. I mean, we know that, listen, whenever we get people together indoors and you do it at a population level, you're going to see spikes in cases. It is still a bit early for Easter, but, this is reflective of what was probably happening 7 to 14 days ago within that window. Stay tuned. It probably will get worse. The number will probably go higher before it starts to get better. We're not going to see the benefits of the current measures that are in place for about another, 10 to 12 or so days is when we'll start to see the earliest benefits of that. So I mean, I think people should get ready because you're going to see some pretty ugly numbers soon.
So, and unfortunately, before all holidays, we have predicted this. We've talked to experts such as yourself, and the warning of going into a holiday, don't go to the gatherings, try to keep the Zoom call thing happening. And again, as you mentioned, that is going to be the next week or two, is it not?
Yeah, it absolutely is. It absolutely is. And again, it's probably not all driven by people hanging out over Easter. I mean, I think that you can't ignore that. That's certainly a component, but we just know there's a lot of community transmission, regardless of Easter. There's still a lot of community transmission. We still have people who sadly can't work from home and are going into work and bringing the virus into work and bringing it back into a big intergenerational home as well and amplifying it there. Like, there's just lots of different avenues for this virus to be transmitted. We've given it lots of different avenues to expand, and it's expanded. And, it stinks because, as you point out, some of this was discussed, over a month ago about the variants, about how transmissible they were, about how we need to do more to curb them. When you take your foot off the gas pedal because things start to look pretty good, you can't be surprised when they rebound. Now, it doesn't mean you can't take your foot off the gas pedal a little bit, but I think this isn't hindsight. Many people were discussing this at the time, but it was probably too much, too fast.
We know the term darkest moment before dawn. It certainly feels that that's where we are. However, and again, as you're saying, it looks like case counts are going to continue to rise for the next week or so. The one advantage here, Doctor, is, like you said, the vaccines are coming in. So hopefully at sooner or later, these two are going to intersect, and perhaps we're not going to see a shutdown or lockdowns extend as much as they did first and second wave. Accurate?
I don't know. I mean, Listen, we'd be foolish to ignore the vaccines. They are amazing. They work. They have transformed the demographic of this wave. Like, remember the horrible scenario that unfolded in long-term care during wave one. It was terrible. Thousands and thousands dead. Then we failed our most vulnerable a second time. Thousands and thousands dead during wave two. How about wave three? Nada. Nothing. Yeah. Not a peep. Vaccinated, protected. It's not going to be 100% perfect, but like, that area has been quiet. Okay. Same with community dwelling seniors over the age of 80. We don't have 100% of them vaccinated, but there's a lot of them are, and we just don't see them coming into hospital. So as the vaccine program rolls out, I should add to that, frontline healthcare providers. I mean, this is hindsight, but like, wow, luckily they're vaccinated because, who are you going to use? Staff? Your hospitals are getting stretched beyond capacity. Luckily, we have the staff to function within the hospitals because we're going to need all hands on deck. But of course, like, as these vaccines roll out, as they expand in high burden settings and in people who are at greatest risk of having a severe outcome, we are seeing the benefit, and we'll be able to realize more and more of that benefit. But of course, that takes time. We're vaccinating about 100,000 people a day. That's still got to expand. I'm happy about it, but it's still not good enough. I hope we can get over 150,000 a day. They're pouring into those at-risk neighborhoods. It's still going to take time. So we're going to policy our way out of this wave. I don't think we're going to vaccinate our way out of this wave.
You said, obviously, seniors in a better situation than they were first and second waves. Who is in hospital now? Because obviously we're hearing more and more about young people who seem to be pretty much immune to all of this during the first and second wave. Now in the third, they seem to be the focus. Yeah,
they're certainly less immune, but by and large, if you put, if you have a 20-year-old with COVID-19 and a 60-year-old with COVID-19, the 60-year-old is far more likely to land in hospital than the 20-year-old. What we are seeing, though, is that the average age is getting lower. Now, some of that is completely related to the vaccine rollout program. The other is related to who's getting infected and where they're getting infected. And, of course, it's not all – people like to think it's young people partying. That's not – I'm not ignoring that could be some component of it, but I think the real component is people are going to work. People are getting this at work or in the community or in places where they can't physically distance from others. And it is not all individual choice. So Yeah, so we are seeing some younger people in hospital. You can't ignore that. But still, I mean, like I just got off a stint on the COVID wards. So don't take anecdotes as data. We should look at data. But just on the COVID wards where I was working, yeah, we still had a handful of 80-year-olds. We had a lot of 60-year-olds. There was a couple of people in their 30s. By and large, it was people over the age of 60. But there certainly were more younger people than during wave 1 and wave 2.
Your thoughts on, as now we've seemed to have a lot of vaccine come in over Easter and such, and now we're seeing more targeted approaches in Ontario. Before it was moving down through age categories, then obviously there's focus now still on age categories, but also into these other hotspot areas. Your thoughts?
I love it. I mean, that was the plan. Like, this was publicly announced, I think, in February. It was up on the website, I think, in early March. That's the phase 2 plan. And now it's being operationalized, which is obviously fantastic. We've got the vaccines to do it. Phase 1 was community dwelling seniors over the age of 80, long-term care, Indigenous communities, and frontline healthcare providers. I would not say that that's finished. There still is work to go on several of those fronts, but there's been a ton of work on that front. And as we pivoted from March into April, more and more vaccines coming in, you can move to phase 2, which is continuing with people at greatest risk of having a severe infection. That's still working our way down the age groups, but also adding those with medical conditions. So that's the one category. The other category is people at greatest risk of getting this infection by virtue of their work. So that's essential workers. And the third thing is the communities that are disproportionately impacted. Black, racialized communities, high burden communities. And again, you've heard some announcements where we're pouring vaccines to those communities. So that's the phase 2 plan. It's been around for a while, and now it's just wonderful that we actually get to operationalize it because we have the vaccines to do it.
Will, now that we're using a more targeted approach, will we still see the age increments go down? I think we're at 60 now, 55 plus for pharmacies and AstraZeneca and such. When will we see the next age drop, do you think?
It just dropped, so it should be in most of Ontario. It's at 60 in the high burden areas. It's at 50 in the mass vaccine clinics. And of course, as you point out, AstraZeneca, anyone can get it 55 and up. And then on top of that, in select area codes, there's no age limit. 18 and up can get the vaccine, but you don't sign up for that. We come to you. That's where you've got pop-up clinics and mobile clinics that show up to the place of work that are situated in, the temple or the community center. Like, that's bringing the vaccine to the people, not bringing the people to the vaccine. And in terms of that, 60 is pretty low. 60 is pretty good. It's going to take a while. It's going to take a while to vaccinate all 60-year-olds in the province. There's a lot. And I think once we're finished with that, that's going to take probably over a month, I imagine. But please don't hold my feet to the fire because I just don't know off the top of my head. But then I think we'd be at a position where we'd be able to open up to just adults, anyone.
So still hesitancy around AstraZeneca, although we are seeing polling coming out that people are the approval, the want to be vaccinated increasing. Your thoughts on AstraZeneca and the hesitancy around it? We've seen the health minister obviously get the jab and the premier this morning. Does that help?
Yeah, I think it does. I think every little bit helps. I really do. You have to be transparent and honest about it. Like, those blood clots are real. They're really rare. But they're real, and you can't ignore them. And I think our communication, meaning the global, general, medical, scientific, public health, government, the big our communication has been pretty lousy, I think, right? First we're going to not give it over 65, then we're going to give it over 65, then we're not going to give it to under 55, then there's clots. We could have done a much better job in communicating risk, in communicating benefit, and that completely contributes to hesitancy. We shot ourselves in the foot a lot. Now, there's other things that I think we couldn't have done any differently, but I don't think we did ourselves any favors with this vaccine. At the end of the day, it's a good product. It really works. It really prevents COVID-19. I hope people go and get it. But in the same breath, data's moving pretty quickly as well. We're going to find things out along the way, and as you find out, you have to pivot. Your policy has to keep up to date with your data. So I thought that move for under 55 was totally reasonable. And a completely acceptable policy that's different would have been 18 and up can get this vaccine. However, this is what the risk is as we know it. You can make an informed decision to get this vaccine, yes or no. Like, that would have also been acceptable too. As long as you're communicating risk and benefit in an appropriate manner, I think you're doing something right.
For example, let's take the 55 plus for the AstraZeneca. So what if you're 56, 57? Because there's certain areas that are saying 60. There's jurisdictions in Europe that are saying 65.
Yeah. I mean, this just goes to show you can all look at the exact same data and come out with different conclusions. And like, we've only seen this happen about 8 trillion times during the course of this pandemic. They're all looking at the same data and coming out with slightly different policies and different conclusions. That's okay, as long as you communicate how you got to where you got and you do it effectively. Like, we just open, honest, transparent communication. And same with policy changes as well. Like, when you change your policy to reflect the new data, it's great that it's data-driven, but, like, communicate it. Tell people, this is how we came to this decision. This is why we're doing it. And communicate it effectively so you can build trust and people will align with your decision.
Couple of seconds left here. Any advice for us heading into another weekend?
No, there's nothing new. Don't mingle.
You know what to do.
Right? We've said this so many times. Just stay at home, go outside and hang out, spread 2 meters apart, put on your mask if you're going into an indoor setting. Outdoors are much safer than indoors, but that doesn't mean you have to have a block party outside, but go for a walk, the usual.
Dr. Isaac Bogosh with us, staff physician, general internal medicine, infectious disease, associate professor, Department of Medicine, University of Toronto. As always, doctor, thanks so much. Be well. Thank you for all you're doing for us. We appreciate it.
Have a wonderful day.
Here's the commentary.
Last night, we celebrated my wife's second COVID-19 birthday. She's not 2, just the second one during a pandemic, which basically means cake, candles, takeout, and a party pack of face masks and hand sanitizer for all. She pointed out not only was it another COVID-19 birthday for her, but also the second one in lockdown with a stay-at-home order in place, like last year. Ouch! But we all have our own stories of life's moments lost. However, as I said in my wife's card, this has been a year like no other, and the biggest challenge a family may face. In the end, it's bringing us all closer and reinforces what is truly important in life. I think we all appreciate what we have more than ever when we're not scrapping with each other. That part wasn't in the card. So, as we head into a weekend and another stay-at-home order, maybe it's time to appreciate, for most of us, home ain't all that bad. I'm Scott Thompson.
You're listening to the Scott Thompson Show podcast on 900 CHML.
All right, so there's been some confusion surrounding vaccination plans for Hamilton's COVID-19 hotspots and area codes and such. Let's bring in Donna Skelly, MPP, Flamborough-Glanbrook, and is with us now. Donna, thanks for the time. I hope you're doing well.
I am, and I hope you're doing well.
Everything we can, right, as we enter another stay-at-home order. So let's clarify, and then we'll get to the area code stuff. But right now, who in Hamilton can get a shot, and where can they get a shot? Let's start with that.
Okay, anyone over 60 in Hamilton can get a shot by registering on the Ontario website and booking at any of the clinics across the city, and that is for the Moderna and Pfizer vaccine. Anyone over 55 can get AstraZeneca, and I got AstraZeneca on Monday, at participating pharmacies, which are expanding. In fact, I believe another 20 went online today. We will eventually see, I think pretty much all Shoppers Drug Marts in Ontario will be able to. Our objective with the AstraZeneca vaccine program is to get every pharmacy that's interested and has participated in the previous flu vaccine programs, give them the ability to, and the product to vaccinate anyone who is 55 over with the AstraZeneca. We are moving into a second phase where we're going to be targeting the at-risk areas, and there will be specific postal codes, but more importantly, areas where we have seen outbreaks, such as large employers who have big warehouses. We'll be bringing mobile clinics to the big warehouses, to apartment buildings, to places of worship where we can vaccinate people who have historically shown, or areas where we have seen consistent outbreaks. People are, as you said, more and more people are actually now signing up and getting a vaccine, but we have to do more and get the vaccine to areas where we've seen large outbreaks. And that is the large employer, the apartment buildings, congregate settings, places of worship. We've used mobile units to vaccinate at long-term care facilities and retirement communities. Now we're going to be deploying them to these other areas where we've seen hotspots.
All right, let's talk about Hamilton hotspots, because there's been some confusion there. So postal codes, what determines the hotspot?
There are two factors, and there are two different theories of how, and I've been on the phone with Dr. Elizabeth Richardson's been great in explaining how hotspots are determined. The public health unit in Hamilton uses one set of criteria. The Ministry of Health used a separate set of criteria, and they arrived at different hotspots. Neither is wrong, but the truth is a combination of the two is really, I think, would be the best way to approach this. So we're working and collaborating with Dr. Richardson to ensure that all of the postal codes that were identified by both the ministry and the public health unit are included in our targets, and that's what we're doing right now. So as we speak, there are a number that are being considered, two that have been, I think they've already been determined as the hotspots, but it's just a matter of collaborating now and getting all of the information. She made it very clear to me that it wasn't that one formula is necessarily inaccurate. It's just a different set of criteria that was used to determine hotspots. And I think one of the reasons you saw the focus on the mountain was the outbreak at Grace Villa. And so that kind of skewed the numbers a little higher on the mountain.
So at this point, it's still two hotspots, two postal codes, L8W and L9C, that are the only hotspots at this point, but the others are being looked at.
The only postal code hotspots, but we're looking at the other areas as well, such as the larger employers, warehouses, right, places of worship, and apartment buildings. They are also considered areas that will be targeted to ensure that we can get the vaccine in these places. But we'll be taking the mobile units to them. And the way that rolls out is clearly up to the public health department. They were responsible and did a phenomenal job getting into our long-term care facilities. They've got the system in place. They're just going to be moving those mobile units to the targeted areas where we're seeing outbreaks.
So how will people find out about when the mobile unit, whatever, is in their area?
I'm assuming that the public health unit will be doing everything they can. To be quite honest, we rely heavily on the media, and most people who are interested will follow the media if they're interested in finding out where they can get a vaccine. But for people who have been confused or who have a problem perhaps with being English isn't their first language, we are going into places of worship, and the community leaders will be sharing information with their own communities and telling them that we're going to have a mobile unit here. Of course, when it's a workplace, that'll be up to the management at specific workplaces to let their staff know that if they're interested in getting the vaccine, the mobile unit will be on hand, on this day between these hours. So a lot of the places where we're bringing the units we'll hope that they will reach out to their own community members and post signs and reach out and talk to them and let them know that the mobile unit will be on hand and that they're able to get their vaccine.
What about the three municipal hotspots that Dr. Richardson spoke of?
The three, sorry, can you be more specific? Are you talking about the postal codes?
The three other area codes, yeah.
She has been phenomenal advocating.
Postal codes, sorry.
I have been pushing as well, and I'm just waiting. I've been on the phone all morning, just waiting on word of when they are brought in. It's in process. Trust me, we're in the process of including it, and I'm literally just waiting for them to let me know when it's been approved.
Another question, obviously more targeted approach. There was lots of debate last week whether we keep moving down in age demographics or we start shooting it out into different targeted areas, as you are saying now. And obviously with the big shipment coming in over the Easter weekend, it's allowed you to do that. Does that keep the age demographics on track? Will they keep going down every week or two?
No, I think they're going to be targeting more areas, frontline workers. We want to get teachers who work with special needs kids vaccinated. We want to get all teachers and all frontline workers vaccinated, but we also have, people who work in grocery stores that need to have that vaccine. We have people who work with the public, and they truck drivers, people who need to be vaccinated. And again, we are a victim of the supply. And the 2 million that came in over the weekend were already, accounted for. They were spoken for. So it's not as if we've got an abundance of vaccines sitting and we're trying to figure out where to send them. We're still waiting. We have a plan in place to get the vaccines into arms. We just have to get the vaccines. We are, based on the number in the supply chain, targeting what we believe are the hot spots and the highest risk and how we can prevent future spread. But we will lower the age qualification when that vaccine becomes abundant. Now, our premier he received the AstraZeneca today, and he has promised that by the end of the stay-at-home order, we should have about 40% of Ontarians vaccinated. That will make a big difference moving forward. It will be it will really help. I mean, we've seen how effective the vaccine is by the number of outbreaks or the lack of outbreaks and deaths that we have in our long-term care facilities and retirement communities now. It is working. You just have to get that vaccine in your arm.
Lots of hesitancy around the AstraZeneca, and we all know why. We don't have to go back into that again. However, as you mentioned, you've received it. The Premier got his this morning. Do you think that is going to help? You're hoping so. It's going to help?
I know when I posted my picture, a number of people reached out and felt relieved. I've had a nurse speak to me and say, I think it's the best vaccine of the three, which I thought was interesting. I have no concern of getting it at all. I get the flu vaccine the flu shot every year, and I've never had a problem. My arm was sore after this, but that was it. I wasn't sluggish. There were no side effects whatsoever, and I feel safer. Now, it's only been a few days, but in 2 or 3 weeks, I will feel much better, and I'm hoping that anyone who is reluctant should just go get it. Go and get it. If you don't have any sort of a health problem with respiratory issue, and if you haven't had surgery recently, I think you're pretty safe to get it. Get it. It's important. We need you to participate. We need everybody who is able to go make your appointment and get your vaccine.
Have we put to rest the conspiracy theories that Doug's sitting on a whole pile of this in a freezer somewhere?
Well, if people who are playing partisan politics would stop saying that, maybe we could put it to bed. But, it's important that all levels of government work together. And I know you've heard that, but it's not just a line. There aren't millions of vaccines sitting in a freezer somewhere, and they're all spoken for. And
you know what the sad thing is here, Donna? I had a medical expert say that to me on Tuesday. And, of course, they're there because you just got a massive shipment in. And I've had supply chain managers on talking about, or professors talking about, it's like getting groceries on a Saturday. Your fridge is full for a couple of days, and then as the week continues on, it slowly shrinks, and then by Friday it's empty, and you gotta start over again. But usually your fridge is never empty. There's always something there. And it just amazes me to no end how this myth has just been perpetuated, when in fact, and to me, it's solely to take attention away from the fact that, we're still sitting around 40th or 50th in the world because we don't have a supply.
You're exactly right. And I mean, if you want to play partisan politics, I can throw a lot of things out. Why do you think we're scrambling? We only have a limited number of ICU beds because we didn't spend enough money building ICU capacity over the past 15 years. We want to talk about why there was a crisis in long-term care facilities, because for 15 years, only 600 600 beds were created in the province of Ontario. And we knew we were heading into the gray tsunami. We were having an aging population that would require those beds. I mean, we can throw mud at anybody if we want, but to suggest that a government would intentionally sit on vaccine is just, it's silly. It really is, it's irresponsible. We aren't sitting on vaccines. We are trying to get them out. They are all spoken for. People want the vaccine and have booked. And if we were sitting on a million vaccines, we'd be giving people their second dose.
Yeah, and we wouldn't be debating who gets it next or why we're waiting for 4 months to get to the other to the second shot. Another thing I wanted to chat about, Donna, too, and it seems that with the Prime Minister, credit to him, he is trying to make this more clear. I was watching his news conference earlier today, and the whole issue about sick leave. And again, I'm watching medical experts say that we need the province to pay for this sick leave, and the Premier spoke out about it the other day at his news conference, and thankfully the Prime Minister is also doubling down on this as well, as he said in his news conference, that this is a federal issue and this comes from the federal government. That's what this program is that's already or these programs that are already in place.
And for the critics who are arguing that we need paid sick leave, why not post it on your website that the federal government is providing 20 paid sick days to anybody who needs it? And it's about a 3-day delay to have it deposited in your bank account. We can't absorb more costs because we are already trying to, come out of this COVID-19 pandemic with a huge amount of additional costs, directed towards our province, and we're going to have to pay for it at one point. The federal government is already providing sick pay. Why would we do the same? It doesn't make sense. And Andrea Horvath has said this time and time again, we need paid leave. Well, we have it. Let people know it exists and help them obtain it. But don't just stand and scream and say, we don't have it when we do.
All right. Obviously, we're heading into a weekend of stay at home and such. Third time we've done it. What's the message here? What do you want Hamiltonians to take away from this?
Go out, take your dog for a walk, go for a run, go for a jog, go for a hike. But just remember, we're so close. But this new variant is dangerous. It is spreading fast. It is attacking younger people, and it is deadly. So when we say stay within your bubble, stay within your bubble. Wear your mask, wash your hands, and get your vaccine. And we will get through it. It's awful, and to have, one group of people calling me saying, shut everything down, and another group saying, you're killing us with our, we've got to get back to work. It's a tough position to be put in. But this is our problem, and we had to make decisions, and we will wear the results of the decisions we've made. But right now, we believe the best thing to do is to get a vaccine, and then we will be able to fight this pandemic. But it really does depend on the numbers of vaccines we can get in arms.
Obviously, that being an issue, we've seen, for the last 4 months, what we've gone through trying to get vaccines and where we are in the world trying to get them into people's arms. But you have to be confident that we will make huge progress by the summer simply because everyone else has been vaccinated. As the U.S. gets vaccinated, as the U.K. gets vaccinated, the U.S. wants the border open. They're going to ship that stuff north, hopefully, to get Canada vaccinated, just simply because it's in their best economic interest.
And once we are vaccinated, I'm hoping and I'm confident that you will also see a booming economy because people have money in their pocket and they're ready to spend it. And I think you will see that. And I'm really hoping that we go back and support our local industry and support our local businesses and our local restaurants. And I'll be working with every, BIA across the city to ensure that we can do everything possible to get people to support their local entertainment districts and their local businesses so that they can, see some sort of a light at the end of the tunnel and recover the thousands and thousands of dollars that they've lost since the pandemic last year.
One more local question here, Donna. Any idea when we will know more about this postal code situation in the situation that we started all of this conversation with?
I will text you. As soon as I hear, I promise
Sounds good.
I will text you. I promise.
All right, Donna Skelly with us, MPP, Flamborough-Glanbrook, talking about confusion surrounding hotspots in Hamilton and the area codes. More clarification coming beyond the two as we move forward. Donna, thanks for the time. Got her shot. Good for her. The Premier, too. Have a great weekend.
Stay safe.
Good afternoon. I'm Rick Samprin. Hamilton Public Health now allowing residents 50 and older living in 3 postal codes identified as hotspots to book their COVID-19 vaccine appointment through the city's hotline. The province hasn't officially designated postal codes beginning with L8L, L8N, and L9K as hotspots, but Hamilton's Medical Officer of Health has classified them as priority vaccination areas. Flamborough-Glanbrook Conservative MPP Donna Skelly says mobile clinics will also eventually be used to target high-risk areas in those hotspots.
And that is the large employer, the apartment buildings, congregate settings, places of worship. We've used mobile units to vaccinate at long-term care facilities and retirement communities. Now we're going to be deploying them to these other areas where we've seen hotspots.
50-plus residents in the L8W and L9C postal codes can book through Ontario's online portal.
Is your money keeping you up all night? Do you toss and turn thinking, what would happen to your hard-earned money, your rent money, your vacation money, your child's education if your bank closed their doors? Well, with CDIC, you can rest easy. That's right. When your bank is a member of the Canada Deposit Insurance Corporation, your deposits are secure. Simply look for the purple lock where you bank. Like to know more? Visit cdic.ca.
You're listening to the Scott Thompson Show podcast on 900 CHML.
All right, in all that is going on, it may have escaped you that this is the 104th anniversary of the Battle of Vimy Ridge. Part of, obviously, a region in France during the First World War. The main combats were the 4 divisions of the Canadian Corps in the First Army against 3 divisions of the German Sixth Army. The battle took place from April 9th to the 12th, 1917, and the Canadian Corps to capture the German-held high ground of Vimy Ridge, an escarpment, and this would protect the First Army and the Third Army farther south from German fire. We have a very fascinating angle to this story. We're going to introduce you to Dan Moore. His great uncle, Clem Burtis, was interviewed by CHML's Paul Hanover on this day back in 1957 on CHML, and it was the 40th anniversary of the Battle of Vimy Ridge there. Let's play a portion. I'm going to take you back in history to April 9th, 1957, the Paul Hanover Show, 900 CHML, interviewing Dan Moore's great uncle, Clem Burtis, about the Battle of Vimy Ridge.
1916, they decided that about time that we shoved off for England. We arrived at Shoreham by Sea in England and stayed there until February 1917. Then across we went to muddy France. And then we went on up to join the battalion of the 4th Canadian Mounted Rifles. The first action I was in was at Vimy Ridge. We went into the line on Easter Sunday, and at 5:05 Easter Monday morning, everything was very, very quiet. And then it just sounded as though everything was just coming right now, opened up. The command was then by Lord Julian Byng, who later was known as Lord Byng of Vimy. He had the guns wheel to wheel on the whole Canadian front. It wasn't long until we were over in the Germans' front line trench and the barrage had lifted to his support trench.
Oh my, don't you just get chills listening to that. An actual LP recording of Paul Hanover's show on CHML April 9th, 1957, which would have been the 40th anniversary of the Battle of Vimy Ridge. Let's bring in Dan Moore, great uncle, whose great uncle was Clem Burtis, who you heard there. Dan, thanks for the time. I hope you're doing well.
I'm doing very well, Scott, and thank you for this opportunity.
What a chilling piece of audio. What's it like for you to hear that, knowing this is your great uncle?
It's interesting. I was very recently going through a stack of old records that my mother had So my sister and I were going through this stack with my mother, and mixed up among all these old 78s was this LP that had it said it was an interview with 900 CHML, and I had never heard it before, and so the first time I heard it was actually the beginning of last week. So we spun it on my mom's old record player, and it was pretty exciting to be able to hear his voice again after so many years. He passed away in 1982, so it was a real treat to hear his voice again. So.
Wow, it sent shivers up my spine. What was your mother's reaction?
She was very fond of Clem, and Clem was very fond of her. So it was a pretty, for all three of us when we were listening to it. It was an emotional moment. We talked a lot about Clem and his wife Alice and everything that they did for us through the years. So it was a real sweet moment, I think is the best way to say it.
Give us some context here. How did this interview happen? How did you get it? Shed some light on this actual interview.
So my uncle, he owned what was called the Whistle Stop Cafe, which is on Main Street East in Hamilton, and right beside Gage Park. And CHML at the time was right down the street. So the folks down at CHML used to come down to the Whistle Stop for lunch and probably dinner, and they got to know my uncle and my Aunt Alice quite well. And I still remember him talking about the days when he owned the Whistle Stop and the folks from CHML coming in and having lunch, and he was friends with a lot of the people down at the station at that time. So they must have known that, or they found out that he was in both wars. Actually, he was in World War I and II, and so when the anniversary, the 40th anniversary came about, I can just imagine somebody saying, "Hey, Clem, why don't you come down to the station and let's do an interview, and you can tell us about Vimy Ridge."
So, how did this come to your possession now?
So, this is where we found the album in the stack. And then my brother-in-law, Ian, he created a digital file for me last week and emailed it to me. So so we have the actual item is at my sister's house now, and I have the digital copy, and I just thought I'd share it with others because it's not often that we get to hear the voices of people that were actually part of events like Vimy Ridge. We see old photos, we see shows on TV, but it's not that often that you get to hear the actual voice of somebody that witnessed and was part of events like Vimy Ridge.
Did your great uncle speak much of his time there to family members over the years? Did he tell stories, or we understand many of those that came back just kept it all to themselves?
Yeah, when I was younger, I don't recall very many stories that he would tell about battles or stuff. He was wounded. He did see a lot of stuff, but he was also a sergeant major in World War II with the 48th Highlanders out of Toronto. So most of his stories were more about the parade ground type stories and whipping the young guys into shape and stuff like that and getting them ready. But he didn't speak too much about the actual war aside from the parade ground. And he had a son that served in the RCAF that was killed in World War II right towards the end of the war. So he didn't. He'd show me his shrapnel wounds and everything. I still remember seeing the dark spot on his knee where there's a chunk of shrapnel, but he never got into details. Not with me.
So, what sort of you were talking about the shrapnel? What sort of injuries did he receive, or what did he tell you about that?
So he was. I know that he was wounded. I'm assuming it was a shrapnel wound in France. I know that he was gassed in France. In World War II, he was with the 48th Highlanders in Sicily, and he was wounded by mortar fire outside Nassauria, Sicily, and the Canadians' action taking Nassauria, and then he was later he was wounded in Holland, again shell fire and concussion. So he so through the two wars, I think he was wounded at least 4 or 5 times.
How old was he when he passed?
So 82, and he was born in 90. So he would have been about 84 when he passed. So, and he passed away in Hamilton. After he sold the Whistle Stop, he lived on I think it was King Street in Hamilton, and so he was about 84, I think.
What do you think he would have thought of what we're going through now?
With the
COVID-19, the global pandemic. Many have described it to very much more like.
Yeah, he'd be telling everybody to chin up and get through it, and suck it up, chin up, and get through it, and march on and march on together, and everything will be okay at the end of the day. And for folks like himself that survived things like World War I and World War II, they saw and had to go through much more than what we're going through right now with COVID. So,
what a great memory to have, Dan, and thank you so much for sharing it with us. It's an incredible piece of memorabilia to have for your family. Is this going to stay within your family? Is there any other interest in putting this in some sort of museum or what have you?
Yeah, I've already. My sister Judy and we've already been talking about the next step and posting, at the very least posting it or making it available to the Canadian War Memorial site. And I've already been sharing the audio with some other historical military groups through social media. So so eventually it belongs in the actual physical LP itself and everything belongs in somewhere where it can be retained and taken care of.
How long is the entire interview?
I think it's about 5 minutes.
Yeah.
Yeah.
I don't know how we're going to do this, but it would be very cool to play the interview in its entirety, some show. We'll look into that, Dan. Dan, what an incredible story, and thank you so much for sharing it with us and part of our history as well. We're greatly appreciated that you shared your family story with us. Dan Moore, great uncle Clem Burtis, interviewed by CHML's Paul Hanover on this day back in 1957 on the 40th anniversary of the Battle of Vimy Ridge. Dan, incredible stuff. Thanks so much for sharing.
Thank you so much for this opportunity.
It is 900 CHML. I'm Scott Thompson. We had a meeting. And we're going to play that entire interview with Paul Hanover and Dan Moore's great uncle, Clem Burtis, on the 40th anniversary of the Battle of Vimy Ridge, 1957. We're going to play it after the 2:30 news. It's about 5 minutes in length. I've only heard portions of it. I haven't heard the entire interview. So what the heck? Let's go for it. It's the anniversary of Vimy Ridge. And I don't know about you, but I found that audio incredibly captivating. So we will play the interview in its entirety and set it up for you after the news at 2:30 if you want to get ready for that. Get your cassette recorders handy. All right. Obviously woke up to the news this morning that Prince Philip had passed away. Let's bring in Patricia Treble, royal contributor to Maclean's, and is with us now. Patricia, thank you for the time. I hope you're doing well.
Good afternoon, Scott. I'm okay, but boy, a gloomy day that hits the gloomy news of today, I think, eh?
It's bizarre because, it's one of those situations where you're thinking, oh my goodness, 99, hopefully makes it to 100, but obviously has been ill, so kind of expected. But man, when you lose somebody of this stature and with this history, it's still startling, isn't it?
I think it is. I mean, he'd officially retired, when he was 95,
Yeah.
But he'd been going gangbusters since before that. He'd been doing, 200-300 engagements a year. I mean, more obviously when he was a much younger man. And he just seemed omnipresent. He was always around for us. And so I think the fact that, that he's now died, I mean, yes, his health was clearly failing in the last little while. When Buckingham Palace would do the update saying he was in hospital, they were simply replying all to the previous update that they had sent. They weren't even putting out new ones. And I think there was a sense that time was running out, especially because he was in hospital for 4 weeks. And it was clear that he was battling infection. He had a heart treatment for a heart ailment, and that, old age was catching up with the man. And look, he did his RCAF exercises every day for decades upon decades. And so I think Canada can have a little hurrah for keeping him in such good shape for so long.
Wow. We can all learn from that.
Yeah.
When will we hear from the Queen on this?
I don't know that we are going to hear from the Queen. She's of that generation that one doesn't. I would expect we will probably hear from the children. The pandemic kind of throws everything for a curve. I mean, it was never going to be a big funeral. It was never going to be a public funeral. I mean, they'd issued guidance long ago, and he'd made that absolutely clear. He wanted a private funeral. It'll be at Windsor. The pandemic will obviously scale that down even further. But I think we will likely hear from the children. You have to kind of just feel, I mean, my initial thought was sympathy for the Queen. This is a man who has been by her side for 74 years, and now he's no longer there. I mean, I can't even imagine what that must feel like.
Do you think, Patricia, she will slow down even more, take a pause, step back, or do you think she'll just keep right on rolling?
I think this will... Look, she's been slowing down for a while, and the pandemic has certainly, contributed to that. I think this will simply just mark another continuation. It might be a little bit of a lurch downward. Yes, certainly. Is she going to abdicate? No. But there's lots of ways she can step back. Charles is clearly, is stepping up, as is William. And I think she's just going to take as much time as she needs. And in a way, the pandemic provides a perfect kind of excuse to just not be in the public eye. And also, I think people understand. I mean, she's turning 95 in a few days, on April 21st. So I think everyone is going to give her certainly as much breathing room as she needs to mourn the love of her life.
I understand that Prince Philip and Harry were quite close. Mm-hmm. Will we see Harry come back for this?
Well, this we don't know. I mean, I've been trying to, amongst everything else, trying to delve into the British quarantine rules for people coming back. It looks as though it depends on if he's been vaccinated. It looks as though there might be a carve-out if he's had both his vaccines and he's 2 weeks beyond it. But otherwise, there's a 10-day quarantine rule, if I've read them all correctly, and I might not have. And they aren't ones to ask for an opt-out, right? They have been very careful during this pandemic. They've done a lot of everything. They've taken to doing Zoom calls and all that sort of stuff to keep up their, with their charities and things like that. They wouldn't ask for an opt-out. And so he's famously close. He was saying to Oprah Winfrey in one of the outtakes of the famous interview, that when he talks to his grandfather, and when his grandfather just wants to end the call, he just closes the laptop. He just slams it shut.
Show's over.
And that is so. I mean, I'm going to say for anyone who knows anything or has read anything about Prince Philip, that is utterly him. He's an incredibly complex man, but in many ways he is an absolutely plain man. Simple man.
How would you describe his character? Because we've heard so much about him, how he can be salty and this and that and the other, and was offensive to some at times. Oh. How would you describe his character?
He really is a complex man. I mean, he's an extraordinary man. And you have to go back and look at his childhood. This is a man, and realize he is perhaps more royal than the Queen. Both his parents were royal. His mother was born in Windsor Castle with Queen Victoria looking on. I mean, he is royal through and through. But he's also a man who really grew up in exile. His family disintegrated when he was 10, and he basically, he went from relative to relative. He had no home address. He is, and so as much as he always had a royal title, he was at once third in line to the Greek throne, but he chose the Royal Navy, the British Royal Navy, fought in the war, and he is a self-made man, a driven man. And yet a man, here's the contradiction, and yet a man who knew he was marrying a woman who would always outrank him, who would have the ultimate rank.
And this was back in 1952, I believe.
Well, but they got married in 47. And
47, sorry.
She became queen in 52. They thought they had a little more time. But he knew what his future was. His future was two paces behind. But he took that role, and he made it. And he took what is a very nebulous role. I mean, you're basically Prince Consort. Yeah. And he made it. So the Duke of Edinburgh Award schemes, he was the co-founder of the World Wildlife Fund. He would do all these technology prizes. He was talking to business. He was, doing all this stuff, doing all sorts of books. I have some of the books, the philosophical letters that he and one of the chaplains of the chapel at Windsor Castle have written back and forth to each other, talking about major religious and theological issues. So like an intellectual man. And he simply as he said, he got on with it. That's what one does. And
how is the UK feeling today? What's it like there, do you think?
Wall-to-wall coverage. I think it is the death of a grandfather. It's like the Queen is the grandmother, he is the grandfather. And it is the death of the grandfather. And yes, I mean, he could be brusque, he could be, some of his comments, absolutely went over the line into racist. But he was also a man who was so omnipresent in everyone's lives for so long that you can't help but the infection. And of course, now they're saying, please don't leave flowers at Buckingham Palace. Please, in lieu of flowers, donate to charities. Sign up for virtual, books of condolence. Please don't come to the palaces. And in a way, I think he'd like that. In a way, you know what? Think of him quietly. Think of what he's done. Think of, who he is as his own man. And look, in Canada, I mean, how many regiments, how many organizations? He was here more than any other country. And I think the last thing I would say is Canadian Armed Forces, they gave a tweet at the earliest when the word was just breaking that he died. And they said, with love from Canada, we send our deepest condolences to the Queen and the royal family.
Patricia Treble has been, we got to stop you there, Patricia. Patricia Treble is with us, royal contributor to Maclean's magazine. Patricia, thank you so much for the time. Be well.
You're welcome.
We will play the rest of that interview we heard in regard to the Battle of Vimy Ridge with Paul Hanover and Clem Burtis, recorded back in 1957, when we finish with the news. It is on the way.
You're listening to the Scott Thompson Show podcast on 900 CHML.
Good evening, everyone. Trans-Canada Credit presents Paul Hanover.
Officer John A. McDonald, as I see it.
Wow. That's what radio sounded like in 1957, the beginning of the Paul Hanover Show. We've been playing a recording of, and we're going to play the entire interview right here, which is, I understand, about 4 minutes long. And this was an old recording of the Paul Hanover Show from this date in 1957. And it was then the 40th anniversary of Vimy Ridge. And we played a portion of it, and you know the story with the great nephew who found this recording and brought it to our attention. Feel free to offer your opinion. Love to hear from you. Mr. Lowe, the retired teacher, says, Scott, giving you a level 4+ performance on that segment. That's an A+ for you older people. Lest we forget Vimy Ridge. Interesting that those soldiers returned to Canada in 1918. They were right into the Spanish influenza pandemic of 1918 to 1920, a very deadly pandemic that cost an estimated 20 to 40 million lives and had 4 waves. This is Clem Burtis telling Paul Hanover what it was like when they stormed Vimy Ridge. Play the interview.
Now it's time for another hi all from Paul.
We have a very simple way in which Mr. Clem Burtis, who is owner of the Whistle Stop on Main Street just south from CHML, is a veteran of that engagement. I'd like you to listen to him now. Well, Paul, it was in 1950 when I decided to join the Army, so I took off for Owen Sound. I was just a little over 16 years of age then. I was accepted and done some training in Owen Sound, and later on we were sent to Niagara-on-the-Lake, and from there to Camp Borden. 1916, they decided that about time that we shoved off for England. We arrived at Shoreham-by-Sea in England and stayed there until February 1917. Then across we went to muddy France. And then we went on up to join the battalion of the 4th Canadian Mounted Rifles. The first action I was in was at Vimy Ridge. We went into the line on Easter Sunday, and at 5:05 Easter Monday morning, everything was very, very quiet. And then it just sounded as though everything was just coming right now, opened up. The command was then by Lord Julian Byng, who later was known as Lord Byng of Vimy. He had the guns wheel to wheel on the whole Canadian front. It wasn't long until we were over in the Germans' front line trench and the barrage had lifted to his support trench, where after a time we moved forward, and all we found there was the odd few German stragglers who quickly surrendered and went to the rear of our lines. We kept on going until we got into his reserve line, and the same action happened as what was in the support trenches, of cleaning up all the odd stragglers that we could find. Some were hidden in dugouts, but it wasn't long before we ferreted them out of there. We went right on until we succeeded in taking the top of the ridge, and from there on we could overlook into Petty Vimy and Avion to our left. We remained there and consolidated our position until April the 22nd, when there was just a little wedge in the line which had to be straightened out. One company of my battalion was sent up along with 2 English battalions, one on the right and one on the left, and this they done, and from then on we just bob-wired the whole of the ridge, which we held and consolidated until the end of the war.
Were the roads muddy then, Clem?
Very, very muddy. There was lots of mud all over the place. Our casualties were quite heavy, but after all, it was really worth it out to do.
Had it been tried before?
It had been tried by the British and the French, but they succeeded in taking the position but not holding it, owing to the fact that they didn't advance far enough to the top of the ridge.
That is what we have of the interview that Dan Moore had sent to us. His great uncle, Clem Burtis, interviewed by Paul Hanover on CHML on the 40th anniversary of the Battle of Vimy Ridge. And as I wrote back to Dr. Lowe, the teacher who has given me an A+, that's been taken down to an A because I didn't pronounce core correctly. And my apologies for that. I'm just a young guy. But fascinating audio of the time. This recorded back in 1957, but obviously talking back to the actual battle, which had happened 40 years earlier, and just some haunting terminology that was used back then, and that we heard from Clem, like clear them out, and talk of putting up the barbed wire to secure the ridge and such. And man, what a frightening time it must have been to live through any of that, and especially to be on the front lines. And you know, as Dan said, when I asked him what his great uncle would have thought about where we are now in the pandemic, he would say, "Suck it up, Buttercup. And let's work together. Let's get her done." And, you know, when you listen to audio like that and you remember what our parents and grandparents and great-grandparents went through, it certainly keeps in perspective what we are all going through now. Many have described this as a war, and there are casualties, but nothing like the destruction. And I'll leave it at that. The destruction and death that went on during those 2 world wars, and it is especially important as we head into another stay-at-home order that we remember the courage, we remember the discipline, we remember what these people fought for, and what they would think of us in the battle that we are facing, and how we are dealing with this. And hopefully, with listening to this sort of audio that just, for me, sends chills up the spine, it will give us more support more encouragement to keep going, to keep fighting, to keep getting through this the way our ancestors did so many times over the years. So thanks again to Dan Moore for sending us that audio. It's something we'll cherish for a while.
The Scott Thompson Show, weekdays from noon to 3 on 900 CHML.
This is the Scott Thompson Podcast, available on Apple Podcast and Google Podcast, or wherever you get yours. And don't forget to subscribe, rate, and review so you don't miss a thing. I'm Scott Thompson, and thanks for listening.
For years, I've heard conspiracy theories about the Denver airport. Underground tunnels, secret societies, and even creatures hidden in plain sight. I never believed any of it till I started getting voice messages from strangers claiming to be entrapped in a labyrinth miles below the airport. I'm their only connection to the outside world, and what I've heard is terrifying. I'll share what I've pieced together, and maybe you can help me figure this out.
Listen to Escaping Denver, free on Apple Podcasts, Spotify, or wherever you get your favorite podcasts.
Something is out there. Please, help me help them.